Earlier today, I got a message from one of my patients that she had received her bone density results from her primary care doctor and that she had osteopenia. And her physician had recommended that she take a dose of Fosamax each week to help build her bone density. And she called asking, hey, is there anything else I can do before I take these medications to improve my bone density? So I started thinking about all of the factors that go into the strength and the density of the bone. And in our risk factors, so many women in that peri and particularly the postmenopausal age group, develop osteopenia, which is a precursor to osteoporosis. And the reason why osteoporosis is so important is because it really increases the risk of fractures, both in the spine and the hip, which can be the most devastating for women as they age. However, even things like falling and breaking your wrist or your ankle can occur when the bones are thinning. So when I think about bone density, I think about what are all the factors that impact this. So one of the things is that in bone density, a little bit of extra weight is actually something that protects you. One of the best ways to improve the bone density is to cause it to remodel. And how you do that is by stressing the bone. So women who are very thin or at the very bottom of the BMI range are at higher risk for osteopenia and osteoporosis because their bones aren't carrying around as much weight. So increasing the weight a little bit, preferably within the normal BMI range, can be protective. The second thing is that weight-bearing exercise can be helpful. So an example of weight-bearing exercise would be jogging or walking. Something like swimming isn't going to help improve the bone density because most of your body weight is being taken by the water. So you need the effects of gravity and your body weight on the bones of your spine and hips. In addition, doing weight training can help remodel the bone all over because those weights, if you're doing arms on the biceps, when you lift weights at a heavy enough level, some of those little fibers tear and some of the little fibers that are attached to the bone tear, and as those remodel, the bone can become stronger. So that physical activity is one of the core ways to improve the bone density. Secondly, the reason that menopause brings osteoporosis and osteopenia with it is because women are losing, and men too actually, as testosterone decreases, we're losing the positive effects of hormones on the bones. So for example, estrogen activates it blocks a certain cell called an osteoclast. Osteo means bone and clast means it breaks it up or eats it up. So estrogen stops those things from eating up the bone. So as we go through menopause and we lose our estrogen, those osteoclasts that break down the bone become more active. In addition, progesterone, which is another one of the women's hormones that we lose when we stop ovulating and stop having periods, stimulates another kind of cell called an osteoblast. Again, osteo for bone, blast for build. So the progesterone stimulates the cells that help build bone. And testosterone, as well as some other androgen hormones like DHEA, help improve the strength of the bone. So the loss of some of those hormones with menopause are why we see the incidence rise after that time. There are some other hormonal influences on bone loss, primarily in the realm of cortisol. So cortisol is an adrenal hormone that we release in response to stress. It's our body's natural form of things like prednisone that might be used to treat asthma or an infection or pneumonia or things like that. High levels of cortisol or those medications, those steroid medications that people get for joint injections or asthma can cause the bone to thin. They can be a cause of osteoporosis and osteopenia. So getting cortisol levels under control, getting off of those medications that might contribute to it. And then finally, thyroid disease can also impact osteoporosis only if somebody becomes hyperthyroid. So if they're have a problem with hyperthyroidism because of autoimmunity, or even too much thyroid replacement can lead to thinning of the bone and osteoporosis. So in addition to addressing all of those factors, including your stress, your sleep, all of the pillars of our health, it's also important to make sure the bones have all of the substrates and minerals they need to improve the density, things like magnesium and calcium and boron. So a lot of the ways to make sure that diet is high in those things, or that you're supplementing them, or particularly vitamin D, vitamin K. You know, vitamin D and vitamin K are important not because they go into the bone, but the vitamin D helps us absorb more calcium, whether it's from a supplement or from our food. Pairing vitamin D with vitamin K2 helps make sure that once that calcium's absorbed, calcium goes into the bone. We want it in the bone. We don't want calcium going, say, to the kidneys, where it can make kidney stones, or to the heart vessels, where it can, you know, lead to plaque formation and heart disease. So as we're increasing calcium intake and D intake, it's very important to add vitamin K2 to make sure it goes to the right place. Dietary influences are very important. When I talk about diet and nutrition, it gets to be a little bit of a broken record, because we need to target a lot of the foods. Foods can have an acidic quality or an alkaline quality. And when foods are acidic, it leaches the calcium out of the bones. And I'm gonna give you one guess as to what the most acidic food is. If you're thinking about it in your head, it is sugar. So just like all of the other problems and imbalances that we talk about, sugar exacerbates this problem. So sugars and breads and pastas are all acidic foods. Even meat is a little bit on the acidic side. So we want to target the diet to be more 75% what we call alkaline, which is the opposite of acidic. And that's going to be, you know, primarily vegetables are alkaline foods. So like any healthy diet, the majority of our diet should be vegetables with, you know, if you're not a vegetarian, then a little bit of lean meats, chicken, fish, and things like that sprinkled in, and a little bit of whole grains or healthy complex carbohydrates. So in summary, there are many ways that you can take control of your osteoporosis or osteopenia without having to end up taking a prescription medication.